This is the Aware Families Podcast, a show that brings you a science-based, practical look at how to use the principles of functional medicine to keep your family healthy. Welcome back to the Aware Families Podcast. I believe we are on episode 12. I'm one of your hosts, Tom Flass.
And I'm Brittany Coburn.
So today, since we're well past the pillars, we're kind of doing a series of other different topics. And, we've been, I'd say the last few were probably a little bit more adult focused. So I figured today we'd kind of hit the rewind button and go back and really start with some, pediatric or almost even pre-pediatric, topics that are kind of near and dear to my heart and something I researched heavily when I was writing my book, the Feeding Our Children book. And I think it's really kind of apropos right now with what's going on with the whole MAHA movement, because when we're really looking at trying to make everybody in America healthier again, it starts with the kids, and it starts in pregnancy.
I was just going to say, I know you're talking about how it's, all about kids and babies, but it's about mamas too, right? Mm-hmm. So it's that whole wraparound picture.
So pregnancy nutrition, which is what we're going to kind of riff on today for a bit, and talk about how that really is the setup for things that go on with that child's health decades in the future, and how we really need to start focusing on that, because I don't think it's still nearly enough of a focus as it should be. I mean, I have kids. I haven't personally been pregnant, but I don't know what's your recollection from when you went through that process, as far as like what sort of information you got, or what kind of discussions there were about nutrition and lifestyle and environment.
Yeah. So I think a lot of it, from your OB, you're going to get a lot of information, right? And those first couple appointments are very, very, very full, though. Mm-hmm. And so nutrition definitely is a piece of it. But I think some of the focus, from what I remember, and this is not obviously saying that this is all we covered by any means, but was like what not to eat, right? Versus just on what I should be eating. Yeah. And so I'm sure, I guarantee, because I had wonderful OBs, that they had mentioned, be eating protein, fruits, veggies, all the good stuff. But I just remember more of a focus on, not drinking coffee, or not doing...
No, don't eat sushi.
Yeah, exactly.
Yeah. What were the big other no-nos, like the don't eat?
Well, I remember, watch deli meat, right?
Yeah.
Watch, coffee was like a thing, because I really enjoy a cup of coffee. And so
coffee, alcohol.
Oh, of course, yeah, which that was easy, and then people who smoke, are told not to smoke, so that wasn't a problem for me. But sushi, really watching raw fish, but I don't know.
And most of the moms I've talked to, that was kind of the extent of it.
Yeah, that's what I'm saying.
Take a prenatal, which prenatal? I don't know, any prenatal, so there wasn't a lot of guidance on that,
Unless you sought it out on your own. Mm-hmm. But then again, you're, standing at Barnes & Noble or on Amazon, and you're like, I don't know, right? Because there's so many overwhelming choices that you don't know what to choose.
Yeah. So I figured today, I kind of wanted to lay like a framework of sort of maybe how to think about sort of pregnancy nutrition, but also in the spectrum of like things to pay attention to really try to give that child the best setup possible.
Right, and in doing that, you're going to give the mama the best setup too, right? Because the mom is going to feel her best, which then she's going to grow her best. So. Yeah, there's a lot of pieces to that, and I think this is a great way. I know we both in here try to focus a lot on what to do versus what not to do. Yeah. Right? And then sometimes if you are so full of eating the foods you should be eating, you don't have to worry as much about what not to eat. Mm-hmm. You're not hungry. Yeah. So do you want to start straight up with defining what those first 1,000 days are?
Yeah. So there's this sort of concept or movement, or I don't know what you want to call it, that started back really in some research done in the 80s, and there's this thing called the Barker hypothesis, which I'm trying to remember his first name, but a researcher from the UK started looking at, and it started with looking at children who were born to moms that were pregnant during World War II, and especially what's called the Dutch famine winter. Yep. So this is like 1942 or 43. Obviously the Nazis, the Germans had invaded. They took over the Netherlands and Holland, and they basically all the food was going to the soldiers. Right. So the people, the commoners. The citizens of Holland were starving, including the mothers. And so the ones that were the pregnancy survived, they found out all of a sudden years later, like the children that were born to these starving mothers during that Dutch famine winter had a hugely increased risk of obesity, heart disease, type 2 diabetes,
right.
and and they
later
in life, and they tried to account for all these factors, but they kind of traced it back, and it's like there's something about that, what's called the in utero environment, the environment while the mom was pregnant, that impacted these people's health, the children of those mothers who were starving, that their health, decades into the future, like 3, 4, 5 decades into the future, right. And so then they're like, what's that all about? And they kind of started tracing it back. And so that's where that whole process of, that first 1,000 days and really, I think that sort of really started the process of looking at something called epigenetics, and which is a hot topic now, and people may have heard that kind of buzzword. And so there's, obviously people know genetics, it's a DNA we're all born with, and for the longest time it was thought like your DNA is your destiny, like you're genetically predisposed to get heart disease, diabetes,
right. Like if it's in your code, you will have it.
Yeah. And now we're figuring out, and I mean, and granted that whole research, like the Human Genome Project, unbelievable, feat of science. So there's a lot of valuable information, but now they're discovering like, oh, there's a whole nother layer on that, and that's the field of epigenetics, which is, the only genes that matter are the ones that are flipped on, or I guess like if they're, so if the bad ones are turned off and the good ones are turned on, that's kind of where you want to get to. Right. But so this whole Barker hypothesis and what they discovered is that there was in that in utero environment, the environment while the mom was pregnant, what she either did or didn't eat, overnutrition, undernutrition, all these things, then the baby has this DNA, these genetics, but then this will do things that will either turn on certain genes for certain processes or turn them off, and that can have long-lasting effects, potentially lifetime effects.
Right.
And so,
and Gabor Mate, right? He writes about this in a couple of his books. Like he talks about the same thing, and about how when he was, in his mom's in utero, and his mom's tummy, and then in that first 2 years, because it was the same. And so negative things that can have these far-reaching implications. And then now we have the ACE study, right? Which again kind of reiterates some of that. It's a little bit different than like looking at just nutrition, but if you're having all these other difficulties, like nutrition certainly could be a part of that. But also, like I said, the trauma, the stress, things like that. And so they're finding out now that these things can have multi-generational effects that you can hand down. So not only are you doing these things, and there's different processes that kind of will either silence or turn on the DNA that's kind of beyond the scope of this talk, but there's like these things called methylation, and which is one of the big ones, and you can actually measure these now with some of the new science and these methylation marks, and they're finding that the children of those children can still have some of those methylation marks on their DNA, showing that multi-generational. And what is becoming evident, what's happening now with like the explosion of obesity, type 2 diabetes, all these things, is you're getting this feed forward cycle where the children of these children who had all these other, and this is early life and both while pregnant and early life exposure to all this junk that's in our food, and so basically turning on the genes for heart disease and diabetes early, and then that's then getting handed down to the following generation, and then it's just each subsequent generation is turning on more of those bad genes, and then we're to the stage now where 1 out of 4, 1 out of 5 kids who's graduating high school is pre-diabetic, so it's and not always aware. I know you and I talk about that almost
and
weekly.
Not always aware, and that and that's I think the hard thing to wrap your head around is that process is starting in utero during pregnancy.
Well, because you don't, when you're pregnant, right? What do you feel? You feel everything like associated with baby. You're not noticing all these other things, right? Symptoms that we might now attribute to insulin resistance, right? Or elevated blood sugars, things like that. You're not noticing that.
And gestational diabetes being a part, which we'll talk a little bit about today, but that's a big one, because that being gestational diabetic, not that it's anybody's fault, but that is actually turning on the genes for type 2 diabetes in that baby who hasn't even been born yet, so they're going to be that much more predisposed because of some of these epigenetic things that are going on during the pregnancy. But the better control that's under, then the less of that is going on.
So why don't we like jump into talking about maternal diet then?
Okay, real quick. So the first 1,000 days. So we talked about that.
Yeah,
So
yeah,
the
yeah.
270 days during the
Yep,
pregnancy,
we forgot to do
and
that.
then the 365 days of that first year of life and the second year of life. So,
So
not
yeah,
that they're
0 to 1, 1 to 2
yep.
for baby. Yeah.
So and there's still obviously some of these processes going, but it's just also the rapid. And we'll talk about the kind of different domains of that first 1,000 days in a second.
Mm-hmm.
But that there's so many changes go on, and so much of this epigenetic stuff that's going on that can last a lifetime that's going on in that first 1,000
Yeah.
days. So pregnancy, first year of life, second year of life, that the better you can tee up that kid during that first 1,000
Yep.
days, the better their health is going to be for the rest of their life. So I
Right.
think it's hard to wrap your head around, but
Mhm.
it's again paying that future self, paying that future
Well,
child.
we talk about that, you know, in our 30s and 40s, paying your future self
Mhm.
when you're 70, 80, 90. So,
So-
it's the same concept.
Yep. So this is banking stuff for your
Yep.
child's health, you know,
Right.
starting right off the bat.
Yeah, which, you know, most mamas are all in
Mhm.
on this and just don't really know where to start.
Yeah.
So, okay, so to recap really fast, first 1,000 days, 270 days are when you're pregnant,
Yes.
when you're actually pregnant and you're having the baby in the belly.
Yep. Conception to birth,
Exactly.
if it goes full term.
Okay, and then second, 365 days, and then the third. So you have 270, 365, 365.
Yeah. Added up,
Added up.
roughly about 1,000 days.
Okay. Just
So,
making sure we all are on.
and not that the choices don't continue to matter after
Of
that,
course.
but that's like a window that we really
Yeah.
they're discovering is so important for
Right.
so many things. And,
Well,
and
not just nutrition, right? But like
Yep.
human connection and we
Yeah.
could go into all that.
yep, the environment
Okay.
overall, and then so that which is epigenetics, right? Is
Yes.
like there's something called the exposome.
Yep.
Just to kind of touch on that. So that's a fancy way of saying like all the stuff we're exposed to
Yeah.
cumulatively, like environmental, you know, health versus toxin, sunlight exposure,
Yeah.
stress, diet,
Mhm.
nurturing or not, you know. So there's this that again,
Yeah.
you're right on like that, you know, that whole environment in that first 1,000 days. So not just nutrition.
Right.
And I
And even how you're, you know, and Gabriel Monte talks about this, about how the mom and dad get along.
Mhm. Oh yeah.
And that actually impacts your offspring.
Yeah.
Like later in life.
Yep.
Yeah.
Yeah,
So,
absolutely.
Again, just jumps right into that, what you just said.
So I sort of tried to break this down, like in
Okay.
the book, I break it down into 3 domains, and when
Yeah.
I would give these talks, it kind of led to the book. And so I always think
Okay.
it kind of you can categorize it, the 3 sort of goals, and this is for the first 1,000 days, but also especially during pregnancy. So what are the jobs of nutrition, especially? You know, you want to feed the brain, you want to feed the gut, and you want to feed the genes.
Right. And you're talking, just to clarify, both mom and baby?
Uh,
Or are we
yeah, I
specifically
think sort of for the baby via mom.
Okay, but
you
it
know?
actually is helping the mom.
But it's actually helping the mom
Every
too.
single thing that you mention here and
Benefits
in your book,
both.
it does. So I
Yes.
just want to make sure. Like,
Yeah.
Mom knows that we didn't forget about mom.
Being pediatrics, you know,
Yes, I know.
I'm baby centric, but I know
Yeah.
that how, you know, taking care of mom therefore
huge.
takes care of baby.
Takes care of baby. It's
Yeah.
right. Put your own oxygen mask on first. We talk
Mhm.
about this over and over and over.
Yeah.
So you take care of mom, you take care of yourself, and baby is
Yeah.
you're taking care of the baby indirectly.
Yes.
Yeah.
Yep.
Okay.
So first domain, so feed the brain.
Okay.
There are a lot of critical nutrients
Yeah.
that are involved in brain development. And so
Okay.
the other thing is like when you look at, you go from, you know, an egg and a sperm at conception to, you know, the by the end of age, that second year of life, that brain is like 80% of
Yeah.
the adult size.
Right. I think in your book you actually have really good pictures
Mhm.
that show like the size from like all those stages.
So a lot of things have to happen.
Yeah.
And so this is something that I was always baffled why it wasn't more emphasis of the importance of it. Like, well, you know, we need these nutrients, right?
Right.
And we know, you know, obviously we talk about like lead, you know, that's a big one. Like
Yeah.
obviously the younger you're exposed to like excessive lead, you can lose like 10 IQ points, 20 IQ more, you know,
Yeah.
things like that. So we know the toxic things that we'll talk about,
Right.
but all these other nutrients that need to be there in adequate amounts for proper brain development.
Mhm.
And why aren't we emphasizing that more? You know, so that's why I think like the feed the brain thing, I think it's something that people can, I guess pun intended, wrap their head around. But you know, like think about, okay,
True.
what should I be eating that have these nutrients that are going directly to that growing baby brain?
Mhm.
You know, because that's, you know, as a developing human,
Yeah.
that's I
Right.
think a huge area to focus on.
Right, which is funny. And at some point, we'll do another podcast where we talk about the teenage brain, because a lot of the same stuff happens again. Because at that teenage brain, we're growing and pruning at the same time, so they need like extra support.
Yeah.
So anyway, a lot of what you're saying now,
Instead of
bring it up again.
instead of the nightmare diet that most teenagers eat.
Oh my gosh, it's so hard.
That's a whole other podcast.
So
talking about that.
Point being, a whole other podcast. But anyway, okay, yeah. So
we want to try to get that brain. It's going to be 80+% of its adult size by the time they turn 3, which again is.
And think about that for a second. Like, that's a tiny little human, and their brain. So they are not, they're still little.
Yeah.
And their brain is 80% of the size.
When you watch that, I think that's why they're so cute sometimes. They're like they're toddling around, like a big, they call it like baby fat brains, because they're like. Woo.
Well, that's where they put their arms up and they can't always touch their hands over their head, right? Which is so different from us now. But okay, so do you want to go into like the nutrients?
Yeah, so we'll just touch on that.
Okay.
And especially iron. I always like to start there.
Yeah.
Because I think that's something where we're missing the mark. I think we're starting to get better on it, but so iron is so important both for mom to maintain a healthy pregnancy and for that baby's proper brain growth.
Right. So how are we recommending iron? Like, what is still your number one?
Well, first of all, we need to be testing iron. Every pregnant mom should be tested, and not just like, are they anemic? Because that's what's tested now.
Right.
And for some reason, there's been pushback on this, even though it's rife in the medical literature about how the importance of iron and how the last thing that happens is you get anemic, meaning your blood counts go down, which is measured by something called the hematocrit and the hemoglobin.
Right.
But really the most sensitive marker is something called a ferritin, or there's something else called a transferrin saturation if you get these iron panels. But ferritin is inexpensive, it's easy to measure.
Super easy.
The times when it's less accurate is if there's a bunch of inflammation going on, like if you have an infection, then it falsely gets elevated. But by measuring this ferritin, you can tell what the iron stores are. Like, does that mom have adequate iron stores to feed that growing baby brain?
Right.
And we know that, I forget what the percentages are, but I think as far as actual anemia, maybe it's like a third of moms get full on anemic, but there's probably 50% of moms are
deficient.
I should remember this because it's in the book, but like the percentage of moms that they estimate are iron deficient.
Yeah.
So, and you can be, and many moms are iron deficient without being anemic. So if you just check the hemoglobin and hematocrit in what's called the CBC, you could completely be missing the boat, and they could have really like rock bottom low iron stores, but not quite low enough to make them anemic.
Right.
Right.
So which means it doesn't show up on your lab work.
Yeah.
So nobody's gonna flag it when you go in.
Versus if you check it and all of a sudden you're like, okay, your blood counts are roughly about normal, maybe lower normal, because there's always a change because your blood volume goes way up when you're pregnant. But all of a sudden you check the ferritin and it's 3.
Yeah.
And it should be at least above 30, to be in that good range. Like at the rock bottom minimum, it should be above 20, but really it should be above 30 in order to have enough iron stores to truly optimally feed that growing baby brain. And there's a lot of, a decent number of moms, and there's some OBs and some midwives I worked with, and they're checking it now, and they'll do iron infusions because they either couldn't tolerate the oral iron, or they couldn't get their ferritin levels up to the adequate amounts, because knowing how important that iron is, both to prevent prematurity, to actually help the mom have a healthier pregnancy, and to feed that baby brain, because an iron deficient mom is going to make it more likely that baby and that child are iron deficient later in life, even when their iron intake is seemingly adequate, which seems like the opposite of how it should work, but it doesn't work like that. It actually programs that child to be iron deficient. So the more work you can do to try to maintain iron adequacy during pregnancy, I think is huge. Which also speaks to the diet part of that, which is iron-rich foods. And I think where people can run into problems, and this is just the nutritional fact, is like the vegetarian and vegan pregnancies. Like if you're doing that, really you got to know what you're doing. You have to get your iron levels checked. You have to take steps to get the iron levels up, because so again, biological fact remains that like those foods are not as rich as in iron. The iron forms that are in vegetarian and vegan foods are not as what's called bioavailable, meaning they're not as digestible. There's something called heme iron that you get from animal sources and meats, versus non-heme iron, which is probably a third as absorbable as heme iron.
Right.
So you have to take that into account, and you really, again, if you're doing that wisely, you're getting your levels checked and, supplementing or doing what you need to do to try to maintain iron adequacy.
Yeah, and when they're doing the vegan or the vegetarian diet, we're checking other nutrients too.
Yeah.
So B12 and making sure we're not missing the boat on those.
Yeah,
so,
exactly.
But again, often I think, OBs are doing a nice job of like having that discussion with their patients, and so hopefully they're advocating for them as well. But the patient can also self-advocate and say,
Absolutely.
hey, what do you think about just, I don't eat meat. What do you think about checking some of these other levels?
Mm-hmm.
And I think most people would be open to it.
And I would not accept the it'll be fine.
Right. Yeah.
Like, this is the child's life, right?
Exactly.
Like the it'll be fine doesn't cut it.
Right. Well, it's also mom's life.
Yeah.
So there are, severe consequences to being that iron deficient or B12 deficient.
Yeah.
So.
And then zinc I would kind of put right in there too. Same thing as zinc, mineral, hugely important. Brain development, immune system,
right.
Gut health, tissue,
just
growth overall.
Yep.
And zinc deficiency is not uncommon.
Right.
And again, I think it runs more likely if somebody's vegetarian, vegan, because again, the zinc forms kind of like iron are more absorbable in from an animal source versus a plant source. But things like pumpkin seeds and a lot of the nuts and seeds and things like that are higher in zinc and are great foods to incorporate.
Right.
Unfortunately, the testing is not as easy.
That's what I was just going to say.
Like, iron testing is good, it's accurate.
Yeah.
Zinc testing, is just checking zinc in the blood doesn't really. You can check red blood cell zinc and be a little more accurate, but it's one of those things you just want to make sure you have adequate, I guess on paper, adequate amounts, and having some but not excessive amounts of zinc in a prenatal, I think, is a wise choice too.
Right.
15, 20 milligrams, but not super high amounts, because then you can get imbalanced.
Right. So that's another reason why having a really nice discussion with your OB about a good prenatal.
Yeah, or midwife.
Oh yeah, midwives, they are amazing.
Yes.
We work with a lot.
Yes.
They're fantastic. Up here in Kalispell, we have a bunch of really good groups that we love.
Yeah.
Okay, what else?
Choline. So we'll talk about choline. It's the not often spoken of, but super important. So people generally, if you're pregnant, you've kind of heard about the whole thing with folate, and we'll talk about that in a second.
I think that's pretty much all you hear. I'm just going to interrupt you for 2 seconds.
Yeah.
It's like, don't be too low in folate, because you don't want a neural tube defect.
Which is spina bifida.
Yep, and don't be, they say don't be anemic, right? But I mean, that's very high level.
Don't be anemic. How do I do that?
But I mean, I don't remember once having conversations about choline.
So choline, it's a B vitamin, super, super important for brain development. Actually, as important to prevent spina bifida as folate, because it's also one of these what we call methyl donors. And so, again, not to get too nerdy into it, but the whole process of epigenetics and methylation. Right. Also, methylation is important for detoxifying nasty stuff in the body. Yep. So you want to have adequate amount of these methylation nutrients, which are generally B12, B6, folate, choline. Those are the big four.
We might have to do a methylation podcast.
Yeah, we definitely do a methylation podcast. Yeah. But so needless to say, choline, and they found that the higher intake of choline during pregnancy, the smarter that kid is. Up to like 7 or 8 years old when they stop testing.
And so where do we find choline?
So choline, I mean, eggs are the Mac Daddy. I hear about it. Yeah. So and it's in the yolks, so you got to eat the yolks. Yep. So if a mom eats like 3 eggs, 3 or 4 eggs a day, which there's no downside to that. If they tolerate eggs are a pregnancy superfood. Yeah. So probably one of the highest things in eggs. It's in meat. It's in liver, and again, not, I would say that's not high on a lot of moms unless you're like the paleo, ancestral health type of people. But some moms actually take like the desiccated liver, grass-fed liver capsules and things like that. But liver of any kind, could be beef, could be chicken or whatever. Choline super high in the liver. Okay. I do have my kind of nutrient cheat sheet here, but those are really the big ones. So the eggs, the meat, liver. Salmon is awesome. Actually, tofu does have a pretty fair amount of choline in there. So so that's my kind of little cheat sheet. That
was the other one. So people like me who can't eat eggs, right? So it's like, okay, all right, well, liver it is, I guess, and salmon. I love salmon.
Yeah,
right.
and meat, and then but also.
And it's in a prenatal. Not much.
Not much.
Not
Because
enough?
choline,
Okay.
if you put the amount of choline you need, because they've discovered that you want like 500 or 600,
Okay.
but going up to 900 milligrams a day, there was additional cognitive benefits for that baby.
Okay, and
And this is
nothing
research
bad.
out of Cornell University
Love
that came out, I don't know,
Okay.
maybe like 5-7 years ago.
Yeah.
And so definitely important to get in there. Something that isn't talked about enough, but yeah, again, I think just optimizing that baby brain.
Yeah.
And I think it helps protect the mom's brain too.
Mm-hmm.
So.
Well, for sure. Again, I'm going back to that. Every time we're protecting baby, we are protecting mom.
Mm-hmm.
So.
And
okay.
choline works with omega-3s to
Yes.
enhance that
Well,
baby
you could
brain.
jump into omega-3s right here too.
Yeah.
Because that's the other piece, right?
So another, I think, big sort of misapprehension is, or misapprehension, I don't know, mistaken identity, I guess, would maybe would be a better thing, is that people think that, okay, I'm getting like soybean oil, which has a little bit of omega-3 in there, or canola
Right.
oil, which has a little bit of omega-3 in there,
Right.
or flax seeds,
Mhm.
you know, I think those are the big ones, and so that's, there's sort of different types of omega-3 fatty acids, and there's
Right.
omega-3s and omega-6s,
Mhm.
which are the big two families of what are called polyunsaturated fatty acids. In the American diet, we get a boatload of what's called omega-6s from all the different vegetable oils, plant oils, seed oils, and things like peanut, you know, stuff like that have these omega-6s in there, which your body needs some of, but it needs to be in balance with these omega-3s.
Right. And there's a ratio we're looking for, right?
Yeah, I mean, it sort of depends. We evolved on this up to maybe like a 2-to-1,
Yeah.
and now it's like a 20-to-1.
Right.
So there's way too many omega-6s.
Is
And-
it the same ratio that's recommended in pregnancy as in non-pregnancy?
I would think so, sort of from a functional perspective.
Yeah.
I would think so, and
Yeah.
then
Okay.
really starting to look at absolute amounts of because the plant source of omega-3s is not the same thing as the type of omega-3s you get from fish.
Right.
So the what's called the short chain omega-3s
Yeah.
that you get, which is alpha linolenic acid, which you get from things like canola or
Mhm.
flax or whatever. The body has to do a series of conversion steps to get it to the types of omega-3s that your body actually uses. Your body does not use the alpha linolenic acid, the plant source of omega-3s. It can burn a little bit of it for energy,
Okay.
but it tries to convert it, and it's less than 1% efficient. And people have maybe varying, you know, there's these different enzymes and different genetic predispositions. So some people will be more efficient at creating some of this what's called EPA, DHA, which if you look at on a fish oil
Right.
label, you'll see
Yes,
that
you'll
those
see
are
both.
those are the long chain. Those are the types of the omega-3s that your body actually uses, and it's actually the DHA that is the type that that you get typically from fish oil, but
Right.
that the baby's brain is like a sponge for it
Yes.
because it's at the very tips of the growing ends of the neurons of the brain
Mhm.
cells, and so obviously they're growing their brains like crazy. So
Well, which is probably the same reason we really need to be supplementing again in teens.
yeah,
Honestly, it's because at that age,
Yeah.
that teenage brain, right, where you're all of a sudden we're growing and pruning so rapidly at the same time,
hmm
and you know acne pops up, you know, and hormones are at play too. But
Yeah.
like, exactly what you're just saying.
yeah, that imbalance. And so
Yep.
with the typical American diet, you're getting there's a lot of moms that are getting you know, almost no omega-3s in their diet, and then they're getting tons of this bad, you know, I don't want to say bad fat, but it's certainly imbalanced,
Just
or
an
some of it
imbalance
is
of
bad
it.
fat because it's
Yeah.
oxidized,
Right.
it's the kind of damaged, it's almost like it's hydrogenated when you like have stuff in the deep fryer and it gets exposed to
Yeah.
oxygen and heat, it basically turns into almost like the same type of thing, and we know that those have been supposedly removed from the food supply, the hydrogenated fats.
Oh, right.
Which are damaging to the brain and the heart and everything else. So,
Mhm.
but basically, you want to get enough omega-3s in there to support that growing baby brain. So, if you don't eat fish, you know, again, flax and chia are not going to be enough.
Right.
I just hate
You
to
can
say
add
it.
them.
You can have
add
them,
it.
yeah. But really,
you need-
you'd want to get at least a couple hundred milligrams, you know, optimally probably like 500 milligrams combined EPA, DHA. And they do have vegetarian sources of this now. But salmon is, you know, the smash fish are fantastic, you know, so sardines,
Mhm.
salmon, herring,
Yeah.
anchovies. Because those are all low contaminated. You know, you want to avoid
Yeah.
tuna because it's got high mercury, which damages the baby's brain.
Right.
You want to avoid all the larger fish like the swordfish and shark and things like that. So sticking to these smaller fish, and salmon to my knowledge, is still generally considered pretty safe as far as the
That is still my
contamination.
recommendation. So I'm glad you haven't heard anything differently.
And if you don't eat fish, if fish is one of those things, especially during pregnancy, there can be some aversions and things like that.
Right.
Then taking an omega-3 supplement, I
Yeah.
think, is one of the best things you can do for
and
that.
those are easy.
Yeah.
They really are.
Yeah.
Okay.
So there's a lot more I could go into, but that's like the omega-3 thing.
I know. Like we should keep going. What about?
Yep.
What are the next big
Well,
ones?
protein, yeah. So, because, again, we talked about protein requirements overall
Yeah.
are being looked at, like we're probably underestimating that, but especially you're growing another human
Yes. Yep.
So-
Your belly.
in your belly.
Yes.
So you can't do that on carbs.
No.
You need the protein.
Yep.
And so that's when I think you need to, and we talked about the 1.2 to 1.5 grams of protein per day per kilo of body weight.
Mhm.
So if you kind of do the math, that means like the average pregnant woman's going to need 100 grams of protein, maybe a little bit more.
Probably a little more. Yeah.
Which isn't, you need to be dedicated. Like,
Yep.
really important that all the meals are protein based.
Right. Yeah. And snacks.
Yep,
Right?
and snacks.
And that's the other piece. And that's where if we start talking about what to include
Mm-hmm.
instead of just what to avoid,
Yeah.
right? Because if you're getting enough protein, I mean, you're kind of working,
Yeah.
right?
Yeah.
If we're getting protein. Fiber is still important as
Yeah.
always.
You're
but-
not just doing a bagel for breakfast
Right.
and some cereal for lunch.
Exactly.
There's probably way more moms than we think are somewhat protein deficient.
Yeah.
Interesting thing. This has been more in rat studies, but they found that when they were more predisposed to type 2 diabetes.
Mhm.
Because if you had low protein during pregnancy, then your pancreas and the pancreas of that baby did not have as many of the insulin producing cells
Oh,
as
interesting.
somebody who had adequate protein.
Yeah.
And again, I don't know if this has ever been, there's been a way to
Right.
verify this in human studies, but in rats they found this. And so there's a thought that, that could be contributing to this incredible explosion of prediabetes, diabetes that we're
Yeah.
getting. And basically when you kind of get to that stage of type 2 diabetes and you've sort of nuked those cells, you've
Yeah.
kind of used up those cells.
Right. You just maybe didn't start with this.
It's called functional reserve, and so there's a
Yeah.
thought low protein intake during pregnancy leads to this loss of functional reserve of the pancreas,
Huh.
which could potentially contribute to type 2 diabetes development.
See again. So then starting in utero.
Yeah, starting in utero. Yep.
Okay. So protein check. All right.
And then a couple other quick things. So let's go really quick. The folate, folic acid.
Okay. Yeah. We have to hit that.
Yeah, we have to
because
hit
that
that.
is the one that we are told about from day one.
Mhm.
Actually, I think we learned about that maybe in high school.
Yeah. Well, and the whole reason that you look at all these grains that are fortified and they're putting this synthetic form of folate in there called folic acid, which again can turn into the actual
Mhm.
usable form of folate in the body. But the conversion, and especially for women who have this so-called MTHFR
Right.
defects, or it's not even a defect, it's just it's a variance, yeah.
Gene variant.
And so with this MTHFR, that again people have probably heard that buzzword.
Mhm.
It stands for methyl tetrahydrofolate reductase, which is the key enzyme that takes folate into its active form, which is like a methylfolate, and that's what your body actually uses to prevent spina bifida, to foster and promote brain development and growth, to do the detoxification enzymes.
Right.
Before that, it's not useful. Your body just doesn't do anything.
Yeah.
And so that's why a lot of the good prenatals now are actually having methylfolate as the form of, rather than synthetic folic acid,
Mhm.
because they're also finding that synthetic folic acid in high dose may actually be toxic.
Right. Well, there is some research out there that too much, exactly that can be cancer causing.
And potentially cause some, I don't want to say birth defects, but adverse events, adverse effects in the infant.
Yeah.
So because before the answer was, just give them grams and grams of,
Right.
instead of, because usually it's in micrograms of folic acid, but they're talking about
So
2,
there's
3, 4,
1,000.
5 grams,
Yeah.
1,000 micrograms in 1 gram.
Perfect.
And so, but again, if you're supplementing with the actual methylfolate, that's the
Mhm.
active form in the body, you don't have to worry about any of the toxic buildup. I still don't think you should megadose with any of these things unless you're specifically advised to by your OB or midwife. But again, if you're using the form that's actually used, you don't need to megadose because
you're actually able to absorb it. Yeah. And then that can go into GI health and all of that too, because if we're not,
Yeah.
So that would be another reason.
So,
where
so again, quick piece of advice.
Medicine.
Yes. Yeah.
Yeah.
If you're taking a prenatal, which I advise for
Yes.
everybody, make sure it's got not folic acid, but the methylfolate. That would be my advice.
Right. Okay.
Yeah.
That's a good idea. And it'll say right on the bottle, because it'll say on the ingredient list if it's folic acid or if it's methylfolate.
Yep.
Perfect. Okay. Do you want to just briefly touch on calcium, magnesium, vitamin D, or just kind of say make sure they're in there?
I mean, I think pregnant moms should be probably checked for the vitamin D levels too, especially in the northern hemisphere.
Should,
yeah.
You know,
especially pregnant moms.
Yeah, and for a lot of reasons. You know, remember I was telling you I did my research, my graduate research on postpartum depression, and the higher, so the more northern latitudes we were, the increased incidences. You know, we didn't check vitamin D's in that research, but I think that would have been an interesting comparison.
I mean, it's involved in brain development for the baby.
Yep.
It's involved with the immune system functioning, so potentially helping prevent allergies.
Every
you know,
system touches vitamin D.
So if you look at the explosion of things we're having, are they like these, brain issues in kids, immune issues in kids? Like vitamin D, that's a low-hanging fruit.
Right, it's easy.
And we know the prevalence of a vitamin D deficiency in these northern latitudes is high.
Right, that's what I'm saying.
Especially for people of color.
Right, yeah, because you're not absorbing, you're actually blocking it.
Yeah. Yep.
Okay.
So that, magnesium. I got, if you're talking about, so calcium, magnesium, real quick. So calcium, everybody's heard, obviously you need it for growing the baby skeleton and things like that. And it does help prevent preeclampsia, which is, a condition that's not uncommon where, high blood pressure, premature birth.
Yeah, and then you end up usually in emergency procedures to have baby early.
But I don't think enough lip service has been paid to adequate magnesium during pregnancy.
But that's even during life.
Yeah.
That's what we're finding now. I mean, I start almost everybody on magnesium. I haven't yet found a real great reason.
But especially during pregnancy, making sure you're getting, so magnesium foods would be things like your nuts and seeds and your beans, things like brown rice and quinoa are high in magnesium. So these plant foods are really good at it. Most Americans are not getting enough and maybe be getting leached out of our food supply just from over farming and certain farming techniques and things like that.
From PPIs and doing different.
Not absorbing it,
So,
pregnant mom who's on an acid blocker because she's got reflux, then all of a sudden you got to realize.
I got to tell you, what mom does not have reflux a little bit when you're at that 8th, 9th month? Just here to say, like
it gives me the willies because they're not talking about it. You stop absorbing iron, zinc, magnesium. All these things need stomach acid in order to be absorbed.
PPI is really fast. Omeprazole, Nexium, Protonix, like those are the medications we're talking about here.
Yeah, and they mess up the microbiome, which we'll talk about in a second. The whole
we've all, I'm pretty sure.
Yeah.
Use those.
So, and we talk about, so we kind of talked about all those things really quickly. And I do have like a little cheat sheet thing that we give to our, if we are seeing somebody who's pregnant, and actually some of the OBs and the midwives that we kind of work with have my little cheat sheet that they kind of give out.
Which is awesome.
And eventually we're going to be doing a baby boot camp functional medicine pregnancy course that we're working on right now that will be, so stay tuned about that.
Yeah, for sure.
But it's fiber. We probably don't, not just because there's constipation.
But there is that.
There is that, and it's legit.
That's a major thing.
Yeah.
Like that, and that's a thing that actually we notice, right? So a lot of these things that you've mentioned, because I can just speak from being pregnant a few times, you notice constipation, right? That one is like, oh yeah, can't ignore that. You notice heartburn. Yeah. So these are the things versus we're not always noticing these when we have, slow decline in iron or a slow decline in magnesium. You don't feel it. Yeah. But you do feel these other ones.
Until all of a sudden you get preeclampsia or something like that.
Well, but you don't even always feel that. You just happen to go in and you're
which
like,
magnesium can potentially help prevent preeclampsia too, and premature birth.
Yeah.
Because premature contraction.
Right. Yeah.
The fiber, again, I think that there's the constipation piece of it, keeps you pooping. But the really big thing is like that, so we're talking about the feed the brain part of it, but feeding the gut, meaning like feed the mom's microbiome, which then therefore feeds the baby's gut microbiome.
And the mom's brain.
Because the thing is that your those gut bacteria, they do everything.
It's all connected.
And if the mom's not getting enough fiber, or or does some other things are disrupting that gut microbiome, because during the birthing process, if it's a vaginal birth, that baby gets inoculated or seeded with these probiotic bacteria, mom's vaginal flora, and then via breast milk, which is,
Yeah.
we'll have a whole episode about breast milk and formula,
Yeah.
should feed those good gut bacteria in the baby, which then guide the baby's brain development, immune system development, overall like growth and health. And I mean, there's so many things that the gut microbiome does.
Right.
But starting sort of with the basics, like mom should be doing what she can to maintain a healthy gut microbiome. One of the biggest things is making sure she's getting enough fiber to feed that gut microbiome, and prebiotic foods too. I think is also a big part of that. Yogurt, sauerkraut, kimchi. Sort of depending on what mom will tolerate and things like that. But yogurt's usually a pretty common thing. But making sure that it's a good quality yogurt. Because most of the big commercial brands, they're checking in it. Actually, there's not much apparently probiotic live bacteria left in there. So quality matters.
But the fermented food
piece of it. And then the fiber piece. So we're talking like, the insoluble fiber is the bulky stuff. Important to have that too. But the soluble fiber, which is things from vegetables, you also do get some from whole grains, but that's where things like ground flaxseed, chia seed, could be psyllium, could be oats, things like that kind of gummy type of fiber that feeds the gut microbiome, and then the healthy gut bacteria, which also can actually, believe it or not, help prevent premature birth, because that health of and the pH of that vaginal canal will, if there's what's called dysbiosis or imbalance in that bacteria, that actually will cause a low-grade inflammation that's being directly linked to premature birth. So the healthier that mom's gut microbiome and vaginal microbiome are during pregnancy, the better chance I think they're going to have to going to term and then passing along that healthy bacteria to the baby.
Right. Yeah. So here, in a nutshell, then, with fiber, we are helping mom's gut. We're helping mom's brain. We're helping baby's gut. We're helping baby's brain, honestly.
And mom can poop.
And she's not constipated. And maybe we'll go to term.
Yeah.
And you know what I mean? Like all these little pieces. And so it's like, why not just be working on what we know can be beneficial? And a lot of what we're saying today, and a lot of this education that you're providing on some of these specific nutrients, we have that in our kitchen, right? And so it doesn't have to cost a fortune. It can be eating real food. It's just like back to eating real food again. Yeah. Which, I mean, that's huge.
And selecting, making sure you're getting some of the what I call the pregnancy power foods, if you can, in there that are super nutrient dense.
So why don't you just do a quick
we'll finish off with that, and then we'll wrap up for the day before we ramble on for too long.
Because we could do that for a very long time, which we've proven.
Yes.
So pregnancy power foods, if you had to give us a list, what would you say?
So eggs are awesome because the protein, B12, choline. So eggs, if you can tolerate them, are awesome. Red meat. It's been much maligned in the media, but come on, it's like you have, again, B12, zinc, iron, choline, you have the protein. So there's a lot of really good stuff in there. Obviously your leafy greens I think are good because of the folates and the fiber and
that
the other
can help
phytonutrients.
with that constipation too. So having that, like those leafy bulky greens to pass through. Salmon is awesome. Again, the omegas, the protein, the choline. If you could eat salmon a couple times a week, then that is, I think, a huge boon. Magnesium, again, I think like the nut butters I think can be great using things like almond butter. I mean, peanut butter can be okay if it's the natural peanut butter, it doesn't have all the artificial junk in there. But I think like almond butter or some of the seed butters can be really good. And like seeds on your salad, right? Like the seed toppers, like pumpkin seeds, and
And then for calcium, I think, and the probiotic part of it, like a really good quality yogurt, I think can be really beneficial as well. I think some of the you can also do shakes that incorporate a lot of these things in there, and like as part of the course, and some of the things I've given out at some of the talks I've given is like a baby brain shake, for mom, which is kind of covers a lot of these things and has like a couple recipes for that and things along those lines.
Awesome.
But we kind of just got along, we sort of talked about the gut and the I guess we did kind of cover the feed the brain, feed the gut, feed the genes.
Yeah, we kind of did all three.
In a very quick,
well, and we almost went nutrient by nutrient, instead of going like specifically those three. We did it all in all in one.
So again, all this stuff is, not trying to push my book too much, but feeding our children, and there's one that's just on pregnancy called Eating for Two on Amazon. that's a condensed just for pregnancy guide. And
Yeah.
then there's but Audible. I think you can get the pregnancy guide, the eating for two, you can get on Audible, but the feeding our children is too long. It's basic because that's like more of a nutritional guide from conception through school age, and
Right.
it covers a whole bunch of topics. But this is a big part of it that really goes into detail about
Mhm.
feed the brain, feed the gut, feed the genes, where to get all these nutrients, things
Right.
to watch out for. We
Mhm.
haven't even talked about the toxin avoidance part of it, which is a whole separate podcast that I think
Yeah.
we'll do both
Oh,
for
for sure.
for pregnant moms and young kids, like
Yeah.
how to really try to have a clean environment.
Well, and again, I know I keep throwing in the teenage, but maybe it's because I have teenagers. Excuse me. Right, but the whole toxin thing there, because we have, I mean, there's a lot.
Mm-hmm.
There's a lot. And we can only do so much because teenagers are also independent.
Yes.
And that's good. We want them to be
And
independent.
sometimes spiteful.
I love it. God love it.
But yeah, so hopefully this
Yeah.
wasn't too much brain overload. But again, I think, so if you
This
know
brain's
somebody who,
developing.
yes, this will help your brain too. A lot of these principles apply.
They do.
So if you know somebody who is
Yeah.
pregnant, forward this podcast to them, please, just to
Yeah.
get some of this information out to them, or kind of tell them about the book, and and if there's any other stuff, any other questions, you can always look us up. Look on either my website, which is thomasflass.com, and then our website for the clinic is functionalmedassociates.com.
Right.
And it'll
And we're
have
on social also.
Yep.
So we have Instagram and Facebook, and we try to put out information on all of these topics that we talk about on there. And again, we have a lot of it on our website as
Mhm.
well.
so
Probably more of the baby boot camp stuff though is on yours.
yeah, probably more on mine.
have to
And
post
again,
it
as
on.
we kind of get that coursework going,
Yeah.
we'll kind of keep people posted on the website as to when we're going to start that offering.
Yeah, for sure. Awesome. Well, thank you again for listening to our podcast today, and we thank our producer, Triple Divide Creative.
Triple Divide
I'm
Creative.
doing it wrong every
Yeah.
time.
Sorry, Brandy.
She's amazing. So thank you for listening. Be sure to give us a shout out, a like, share it.
Yeah, please share it.
Yeah, please share. We would love to be able to get this information out to as many of those that could use it. So feel free to reach out to us as well here at Functional Medicine Associates Montana. We'd be happy to see you. We do virtual visits and in-person visits. So yeah, we would love to share what we know.
And then we'll have to figure out what we're going to talk about next for episode Lucky 13.
Ooh,
But yeah, that will be it'll be a surprise because we haven't figured it out yet.
Not yet.
No.
All right.
All right, take care, everybody.
Bye.